welcome everybody. I want to thank everyone for joining us here today, but I especially want to thank my good friend Speaker Pelosi for coming here to my hometown. And thank you, Nancy, for picking Denver to highlight the important impact the economic recovery funds have had on local communities to provide vital health care services and create jobs. I want to thank Congressman Polis for being here today, and I also want to thank my longtime friend John Parvinsky, who's the CEO of the Colorado Coalition for the Homeless, as well as the entire staff here at the Stout Street Clinic for their hard work. I'm so happy to be standing here inside this clinic, which is a beaming example of how our local communities are using recovery funds to not only stabilize the economy, but also to invest in health care. Under Speaker Pelosi's leadership, the U.S. Congress passed the historic recovery bill, which you might remember was signed by President Obama right here in my district just a few months ago. This has enhanced the Stout Street Clinic's ability to serve our community. I was sharing with John Parvinsky, as a young lawyer, I worked with him and the Stout Street Clinic many, many years ago, and to see the growth of this fabulous facility for the homeless people in this community is truly extraordinary. The Stout Street Clinic, as most of you know, is a multi-purpose facility which provides Colorado's homeless population with critical services from health care to housing. And as part of the Economic Recovery and Reinvestment Act, it's going to receive over $10 million that will help it enhance the services it provides to over 16,000 Coloradoans. Just now, which is just half a year since the funds were originally allocated, the evidence of the effect on this clinic and the coalition as a whole is stark. And I'm going to, in a minute, let John Parvinsky talk about how important these funds have been for our community. The funds aren't just being used to provide expanded health care options for low-income Coloradoans. They are also injecting jobs into our economy. And again, I'm going to let John talk about the 25 jobs that these funds have either stabilized or created in this facility. The clinic is also a testament to the role that increased health care services will provide as we try to stabilize our country's economy. While both the Economic Recovery and Reinvestment Act and President Obama's 2010 budget have started to lay a strong foundation, the work, as the Speaker will tell you, is still woefully incomplete. Now is the time for Congress to join with the President in passing comprehensive health care reform. And when we do so, we can multiply that effect throughout the entire economy. Funds that have been used here in the Stout Street Clinic can be multiplied across our community and across our country as a whole to give health insurance to the 47 million Americans who live every day without that insurance, and also to improve our economy as a whole. I'm happy, Madam Speaker, Friday night, since I've seen you, my committee, the Energy and Commerce Committee of the House, approved the health insurance bill at 9:30 on Friday night, and that's the final House committee to finish our business. That bill now goes to the House Rules Committee, on which Congressman Polis sits, to have the three House bills merged into one for consideration on the House floor in the fall. And I look forward to helping lead that fight to make sure that we pass the bill and we have high quality health care for all Americans. And now I would like to have to turn over the floor for a few minutes to someone who's only been in Congress for a few months, but is already a terrific new leader for Colorado and for our nation, Jared Polis from the 2nd Congressional District. Jared.
What a remarkable last 6 months this has been. I recall, as some of you might, that when President Obama signed the Recovery Act here in Denver, I was seated along with our other colleague Betsy Markey near Representative DeGette at that signing ceremony at the museum, and I remember Diana turned to Betsy and I and said, you know, it hasn't always been like this. And what a remarkable and historical time, the sheer magnitude of the challenges we face and the solutions we offer. Just yesterday I was at the groundbreaking ceremony of another American Recovery and Reinvestment Act project in Frisco, in Summit County, a new transit center that they're building. They wouldn't have been able to build without the federal monies from the Recovery Act. This is putting people to work across our state, across our country, creating jobs, improving our health care. The health care IT upgrades that are part of the American Recovery and Reinvestment Act are an important first step towards containing costs and providing a higher quality of care, issues that we hope to complete with successful passage of health care reform in the fall and through the winter. So the work has begun. We're seeing the effect of that every day as projects that have long been on the books and people have been trying to find funds to do. We're able to build America, make America stronger, create jobs in the process, and get our economy going. And the example here today of the clinic is but one of many Colorado recipients of Recovery and Reinvestment Act funds, an example of many across the nation, both from schools to healthcare clinics to roads to bridges. American Recovery and Reinvestment Act is making a difference for our country and a difference for the workers who are building the projects. Thank you.
Thank you, Jared. And now I'd like to introduce somebody who I've admired up close and from afar for years and years. John Parvinsky, who was running a little storefront healthcare clinic when I first met him, and now is working tirelessly to serve the needs of the homeless people, not just here in Denver, but also across the region, and doing a wonderful job. John Parvinsky.
Thank you, Diana. On behalf of the Colorado Coalition for the Homeless, we want to thank you for being here to witness our work and to learn about the needs that we have for both health care and housing for our homeless population, for families and individuals who have no place to stay tonight on their own. And thank you to Speaker Pelosi for choosing to focus on our important work as part of the health care policy debate and talking about the importance of health care for the homeless as part of the community health center movement, the safety net, which is so important in advancing health care reform as part of our nation. Thank you to Congresswoman DeGette for her long-term support of our clinic. She started working with us as a volunteer, helping people who are homeless, and has been working in supporting us as a public official ever since. And Congressman Polis also has been working on behalf of homeless youth in our community to meet those needs. Now, when you ask any American what are the three most critical issues facing our nation, they will say the economy, health care, and housing. And through these doors every day we see individuals and families come through who are experiencing directly the impact of our economy, the impact of our negligent healthcare system, and the impact of the lack of housing on their lives and the lives of their children. Through these, we see thousands of families literally every day or every year with these life-threatening issues. We're here in the lobby of the Stout Street Clinic, which is our health care for the homeless facility, which provides a full range of integrated health services, mental health, substance treatment services, and integrated housing for more than 15,000 families and individuals throughout the Metro Denver area. We also have a mobile health clinic that's located just outside the door that goes to the four reaches of the metro area to serve families and individuals who are not able to get down to the clinic to get the medical and mental health care that they need. Now, 85% of those that we serve are uninsured. We're able to provide them care and the support that they need because of the support that we get from the community and the support that we get from our federal and state grants, and more importantly because of the dedicated staff and the compassionate staff who work here and the volunteers who work here to make that a reality. Now, last night the Colorado Coalition for the Homeless provided housing to more than 2,100 households. People across our state who would be homeless on the streets, in the shelters, in their cars, if it weren't for the housing that we provided. Now, we firmly believe that housing is health care and needs to be part of our health care debate. Last December, in this very room, we declared a state of emergency for Colorado's homeless population because we were seeing records increases in foreclosures, in evictions, in joblessness, and all of these things were creating an increased need of people not only for health care and mental health services, but for housing. And we predicted at that time that we thought that things would get worse before they got better. Unfortunately, we weren't wrong. Things have gotten worse. Tonight, there are more than 11,000 families and individuals in Colorado who are homeless. We estimate about 42,000 who will experience homelessness for at least one night this year. Half of those are families with children. 20% are veterans. These are frightening numbers. In the 24 years that I've been working on this issue, we've never seen a need like this that needs to be responded to. Demand for our health services here in the clinic, and mental health in particular, has grown rapidly. We've seen a 20% increase in the number of patients who are coming through our doors, and we're forced to turn away many at the end of the day because we don't have enough space, we don't have enough providers to see them. Our mental health clinic upstairs was forced to create a waiting list just last October for the first time. And today, unfortunately, we have more than 450 people who are homeless with mental illness who are on our waiting list to get the mental health care that they need. However, we are pleased to be here to announce that thanks in part to the work of Speaker Pelosi, Congresswoman DeGette, and Polis, and President Obama, that help is on the way. Thanks to the Recovery Act, the coalition is receiving about $700,000 to help meet the service capacity expansion that we need in order to meet the mental health and healthcare needs for those who are coming through our doors. This has allowed us to add 4 new mental health counselors and to retain nurses and medical assistance providers to treat more people in need. The Recovery Act has also provided almost $700,000 additional funds through the Capital Improvement Program to allow us to implement an electronic health record system that will connect the health records of the homeless individuals that we see, so that regardless of where we meet them, whether it's in the mobile clinic or whether they're coming from Denver Health or one of the other hospitals, we'll be able to make sure that their care is integrated, that we have access to their medical records and can provide the best care possible. Just today, the coalition is submitting a new grant request to HRSA for additional funding to create a new clinic, to expand this clinic next door, just on the other side of this wall, to basically double the size of the clinic through the Facility Investment Program of HRSA, so that we do not have to turn away people at the end of the day. That would allow us to increase the capacity to serve 1,000 new patients, 3,000 visits a year, while creating 25 new construction jobs and 13 new permanent jobs. The Colorado Health Foundation has committed $1 million of seed funding to match the federal request. And Ann Warhover from the foundation is here, and we want to thank her for the tremendous support that they've given to Coloradans in terms of helping our most vulnerable citizens. Now, in April, the coalition opened our newest supportive housing development to meet the needs of homeless individuals and families, our Renaissance Riverfront Lofts, a 100-unit apartment building on the South Platte Valley on the river in the midst of the luxury high-rises and condominiums. And the building, which is modeled after our Stout Street Clinic, after our Off-Broadway Lofts, which is located just next door, was filled in just 2 months. We have another shovel-ready project, supportive housing development on East Colfax and Pearl Street, just 3 blocks from the Capitol, that is ready to go as well. We've requested $6 million of Recovery Act funding through the TCAP program to be able to complete financing for this 98-unit development, which will create additional 50 full-time construction jobs, 15 retail jobs, 7 property management and service jobs, as well as generating $35 million of additional economic activity in the community. All of these things, in addition to a prevention program funded through HUD, and working to keep families in their homes, helping families and individuals that become homeless move into housing more quickly, all of these things are made possible because of the investment of the federal government in the Recovery Act. In closing, I believe we stand at a crossroads, a critical crossroads in our nation's history. we're at a convergence of where crisis and despair on one hand that we see in the eyes of homeless families and individuals every day, and we see opportunity and hope on the other hand. If we do not take advantage of these opportunities to invest not just in the physical infrastructure of roads and transit and other things, but also invest in the human capital that's necessary to help most of those who have been hurt the most by this recession, we'll be held accountable to history for our failure. We believe the solutions are clear. We need to solve homelessness and health care. The answer is investment in housing and reform to our health care system so that all citizens in our country have the access to the health care, the mental health care, and the housing that they need to live the American dream. And these folks are going to help make it happen. So thank you.
To introduce somebody who understands not only the importance of passing these programs and funding these programs from a national perspective, but understands how they work every day in every community in this country. She needs really no introduction. My boss, the Speaker of the House, Nancy Pelosi.
Thank you very much, Congresswoman DeGette, for your kind invitation to be here and for your generous introduction. Here we are again in Denver and Colorado talking about health care.
Denver Health.
The Denver Health, we were on a previous visit, and as we began to write our recovery package and now our health reform bill, we did so with benefit of the thinking of the innovation that is happening in Colorado and the holistic approach that we see here today under John Pravinsky's leadership. I just want to say a word or two about my colleagues. Congresswoman DeGette referenced that on Friday evening she was part of passing the bill out of the Energy and Commerce Committee. This was quite a historic event. It meant that now 3 committees in the House had passed the health legislation, which will be brought together. Congresswoman DeGette serves on the Energy and Commerce Committee, where she's been a leader on these issues. When we wrote the recovery package in January, it was with an eye to making investments in health care in advance of the health care reform bill, and Congresswoman DeGette was an important part of that. When we did SCHIP, Children's Health Insurance Program, when we did the FDA overseeing tobacco, when we did food safety just a couple of weeks ago, Congresswoman DeGette was there for all of that so that we have a healthier America. Thank you for your leadership, Congresswoman DeGette. And all right. As was mentioned when she introduced him, Congressman Jared Polis is new to the Congress, but you never know it. Effective from the start, hit the ground running, coming in with his commitment to education, to healthcare, to creating jobs, to his commitment to small businesses, and that's a place where he's made a tremendous difference in the healthcare reform bill already. And his role on the Education and Labor Committee, which is one of the 3 committees that did the healthcare bill, he's been a champion for small businesses there. And when we have our final product and the small business language is approved, be no small measure to the effective leadership of Jared Polis. So thank you, Jared Polis. John Pravinsky, to listen to you talk is to hear the blend of idealism, about caring about people, about the compassion and the justice that we want for all people in our country, wedded to a strategic thinking about to how to get the job done. As we toured this facility, the Stout Street Clinic, and I'm so glad that so many of you are now more aware of what goes on here because of the healthcare debate and because of our pride that we take in the funds that were in the recovery package that came to the Colorado Coalition for Homeless. We learned so much more about what is happening here. We see a place of dedicated professionals working with volunteers to give the respect that the clients who come here deserve. We see a facility that, again, respects the clients who come here. We see a holistic approach where you can't talk about ending homelessness or addressing it unless you address the health needs and mental health needs of the clients who come here. We see the vision, the gift of sight, the gift of vision in the ophthalmology section here, the 100,000 prescriptions, something like that, each year out of the out of the pharmacy that is here. But in every, we didn't visit the mental health section. We did hear about it, out of respect for the client's privacy. We just heard about it, but it is quite remarkable. This facility and this coalition is a perfect model for the country. It's of the right size so that it can move quickly, as you said, and have the agility to get the job done with fresh new thinking in an entrepreneurial way about how to meet the needs of the homeless and those who need access to health care. Again, as you said, in the community health center model, but also of such significance that it is of national significance. There's a reason why this money came to this initiative. It's because it is of national significance, a model to the nation on how to get the job done. Springing from an idealism that John Pravinsky just exudes, and it's a joy to be in his presence, and really quite remarkable to hear the record of accomplishment that is being done here, being achieved here. All of this takes place at a time when we are not only bragging about what is happening with the recovery package, or that it is some of it has first steps toward health care, universal quality, accessible, affordable health care for all Americans, but takes place at a time when that legislation is in the works. We see all the interest in it on one side or the other, and that's healthy in our democracy. We don't want people to be afraid of the facts. We don't want them to be blocking the ability for people to learn what this bill is about. It's quite remarkable in that it will lower cost, improve quality, expand opportunity, coverage, and retain choice. If you like what you have, you can keep it. It will do so in a way that takes the cost of healthcare down. It does so in a way that gives stability and peace of mind to America's individuals and their families, makes businesses more competitive because of reducing the cost of health insurance for their workers, makes our economy more dynamic because of the entrepreneurial spirit it will unleash if people are not tied or job locked because of their need for health care. And it is important to our budget because by lowering medical cost, we will, as the president says, health care reform is entitlement reform, reduces the deficit. So we're very excited about how today fits in the scheme of things because it brings together two important initiatives of the Obama administration, the recovery package and the initiative on health care reform. And let me just say, on the health care, because John and others have talked about what is coming here in this package, let me say about the recovery package. In Colorado alone, the Recovery Act meant $874 million for health care, $600 million for unemployment benefits and job training, $507 million for transportation and transit in the state, and $941 million in education funding, including funds to help 2,000 Colorado students receive Pell Grants. This is in addition to the tax cut for middle-income people and the stipend for our seniors. So it has brought a huge amount of money to Colorado. And while we're on the subject of what brings to Colorado, slipped my home state, let me say what this health care reform bill will mean to Colorado in terms of numbers. Did you know, and people don't want you to hear these facts, but did you know that Colorado will receive 141,000 small businesses could receive tax credits to provide coverage to their employees? 141,000 small businesses in Colorado. 51,300 seniors would avoid the costly donut hole because we're shrinking the donut hole in our legislation. 9,790 families could escape bankruptcy each year due to unaffordable health care costs. This is a big issue for a family to be bankrupt because of health care costs. And doctors and hospitals would get payment for $535 million to provide care for the uninsured, cost we all now share. And 681,000 individuals would gain access to high-quality, affordable health insurance who do not have it now. This will make a tremendous difference to the health and well-being of families in Colorado. And again, members of this delegation are in the lead on the subject. Jared mentioned Congresswoman Markey in his remarks about when the president signed the Recovery Act, and she is fighting very hard for small businesses to make sure this package is fiscally responsible, that it does not add to the deficit, and recognizes, of course, that small business and fiscal responsibility are what are necessary to grow our economy. I'm very pleased to hear what John has said, this money, how this money would make a difference, whether it's health IT systems, to expand the electronic medical records here. That's important for integrating the services that are here, whether it's pharmaceutical and mental health services and the rest. Allow clinics to meet increased needs and those needs are because of reception, and help 1,000 families find housing solutions and create jobs as it does so. So thank you, John, for what you do, for your tremendous leadership, for the example you are to the country, to all who work with you here at the Stout Street Clinic, but also in the Colorado Coalition for Homelessness, and also for your hospitality here today, so that we could share our hopes and our enthusiasm for the future, springing from what we have done and what we will do when we pass the affordable, quality, accessible health care for all Americans under the leadership of President Barack Obama. Thank you.
Question for Madam Speaker. What was happening out on the sidewalk here before you arrived?
But before I arrived, I haven't the faintest idea. How would I know?
Madam Speaker.
But what you see is, I think, a display of the democratic process where people come forward and express their views, and we all respect that. It's what we look forward to in this this time in August, as we prepare to blend the bills. As Congresswoman DeGette said, these bills will now come together and go to another. Jared Polis is on 2 committees of importance. He'll have 2 opportunities to make his imprint on this legislation. But what we have to do is say to people, don't be afraid of facts, because what is in this legislation is very, very positive. It's very positive. No longer will families be deprived of health insurance because they have a pre-existing condition in the family. No longer will you be not have health insurance because you've lost your job, because you changed jobs, because you want to start a business or be self-employed. And if you are in the disabilities community or have chronic illness, think of this. Under this legislation, your premiums will be capped, but your benefits will not. No yearly, no annual or lifetime caps on your benefits. The list goes on and on as to why peace of mind and stability for America's families will be strengthened by this legislation. We want those facts to be out there. If you're a senior, we're closing the donut hole. If you're a young person and you're in college or just graduating, you'll be able to stay on your parents' insurance until you're 26 years old. If you're a veteran, there are very good things in the package. Again, we had a press conference in Washington this morning. I wasn't there, but it was under the auspices of the Joint Economic Committee. Congresswoman Carolyn Maloney of New York presented what this means for women. It makes a very big difference for women. So in so many different ways, it has a direct impact on people, and that's what this is about. It's not about ideas, it's about people and what it means in their lives. And we're determined to make a positive difference in their lives.
Madam Speaker, as you campaign for this around the country, what do you say to those people who say the only Democrats actively campaigning for this are the Democrats in safe districts?
Well, that's not true at all. Yeah. That's not true at all. Do you want to speak to that?
Well, if you could both answer.
I'll let you.
I will tell you, as chief deputy, one of the chief deputy whips for the Democrats, many of our new members in swing districts said to us as they went out, we need more time to talk to our constituents about this bill. And so the speaker said, okay, we're going to do that in August. And I think that people across the country have been having different meetings with their constituents, town hall meetings, telephone town hall meetings. I'm having a telephone town hall meeting tonight. Congressman Polis is having them. Congressman Perlmutter is having them. John Salazar is having them. Betsy's having them all around the country. And I think what the speaker said is the important point. People should not be scared by scare tactics. They should find out the details of this legislation. They can go on the speaker's website, they can go on my website, they can go on Congressman Polis's website, they can find out the details of this plan, and when they do, they'll find out that many of the myths that are going on out there will be dispelled, and they're actually going to be better off under this health care plan. Next question.
But you don't deny that there's a rift within the party, do you?
No, there's not a rift within the party. No, no, let me speak to that. Our party has great diversity, geographic, generational, gender, ethnicity, you name it. We have diversity in different ways of thinking. And members come from their districts to represent their districts. I tell them your job title and your job description are one and the same, representative. And they come and say, this is how we think we can represent our districts better in this health care bill. Make no mistake, everyone wants to have universal, quality, affordable health care for all Americans. I believe that's probably on a bipartisan basis. I know it for absolute certainty on the Democratic side. But members know better how certain policies relate to their districts, and they've had their input, and they have been part of the process. So I don't see it as a split. I see it as a healthy debate where we have brought people together, found our common ground, passed three bills in the Congress, in the House, which will now be blended into one, which will be up with the Senate bill. Do we have diversity of opinion? Yes. We do not have a split in the party.
Let me add to that, because as the speaker knows, in the last few weeks we had the Blue Dog Democrats who are on my committee, the Energy and Commerce Committee. Many of them are from rural, more conservative areas who were concerned with some aspects of the bill. They negotiated with the speaker and the president and others, and they were able to talk about some different terms in the bill. But then when they came back, some of the moderates and liberals on my committee, and also at least one Blue Dog, were very, very concerned about the negotiation. And so Chairman Waxman and I were able to pull these Democrats together. They were people from places like New York City and Chicago, all the way to Arkansas and Louisiana. And we ended up with a unity bill that came out of our committee. A few Democrats voted against it, but most people voted yes. And in the end, people came together from across the political spectrum as Democrats with the bill on Friday night, and we felt that the bill was stronger because of that. We are a diverse party, and we're going to work together to make sure this bill is done, but that doesn't mean that there are divisions within our party.
Last question. Speaker.
We call that the legislative process.
The protests.
These town hall meetings where
Excuse me.
I'm sorry.
The protests seem to have changed the strategy somewhat in some cases for Democrats delivering their message here. That a couple of town halls have been either sort of semi-closed down, or do you think that that's is that an issue? Is that an issue that needs to be addressed, or what? How do you
No, members know best how they communicate with their constituents, and it's up to them to deal with. Some do it Congress on your corner, government in your grocery store, town hall meetings, press conferences, teleconference, town halls. And it's up to each individual congressperson to decide what they want to do. But there's been no change in strategy. The plan for August is to have a discussion, to listen carefully to what people are saying, what ideas they may have to improve the legislation as it affects them, but to be very confident in the principles that we are putting forth. Higher quality, lower cost, more coverage, and choice, retaining your choice. To do so in a fiscally sound way that reduces the deficit, and we believe that we will be successful with that. And so when you hear some of the commotion, what you may not hear, yesterday we had a conference call with nearly 200 members of the House talking about how things were going in their districts. And I'm very pleased. This is called the legislative process. There are differences of opinion. This is the democratic process. There are differences of opinion. This is a very big initiative to change healthcare in America. One point of contention that the insurance companies seem to want to go after is the public option, which is, I just saw a poll this morning that said 62 to 32, the American people support a public option in the legislation that goes forward. This, as the President said, will keep the insurance companies honest, will strengthen competition, and make health care more available to many more people. So we are, in our caucus, overwhelmingly in favor of the public option. The insurance companies want to put a stop to that because they don't want competition, and that is why you see some of these people coming out in the manner that they have. But most people come out with an honest disagreement and a point of view. We welcome that, and that's how we will go forward. Listening, making decisions. There's some very tough choices to make because we must stay under a certain dollar amount, and we must ensure that this legislation not only provides the health insurance and health care for a healthier America, but does so in a way that reduces the deficit. So it's great to be here. I'm so glad that so many more of you are now aware of the great work at the Stout Street Clinic, the great work of the Colorado Coalition for the Homeless. I'm sure you're aware of that bigger picture. To congratulate again my colleagues in the Congress for the work that they are doing to put this forward. When we are ready, we will bring a bill to the floor, and when we do, we will succeed, and that will be a success for the American people, for their families, for our businesses, for our economy, and for our future. Thank you all very much.